everyone, my name is Surabhi and welcome back to another episode of Physio Media where we talk about everything physiotherapy related. In our last video, I spoke about the importance of stretching and strengthening exercises, and I demonstrated exercises for the neck, upper back, and wrists. So if you've been having trouble with those areas, I'll be linking the video above. Make sure to check it out. In today's video, I'm going to be talking to you about low back pain and showing you exercises that you can use to help relieve the pain, whether the pain is because of improper posture or sciatica. Most people who have low back pain seem to have a directional preference of movement, which means that their back tolerates movement in one direction better compared to another direction. The two movements I'm referring to are flexion and extension, or bending forward and bending backwards. When you have low back pain, step one is to figure out your directional preference. Now, if you're in that category of people who don't seem to have a directional preference and everything seems to hurt, don't get disheartened that there are treatment options for you as well. My advice is to proceed with caution, speak to your doctor or physiotherapist before you begin these exercises. You can actually use the following exercises to help figure out what your directional preference is. As always, before we begin, I need to add a disclaimer. Please do not use the information in this video to self-diagnose or self-treat. Do not use this video to replace advice given to you by your doctor or physiotherapist. If any of the exercises in the video causes discomfort or pain, please stop the exercise and seek attention from your doctor or physiotherapist. While you're sitting, your lower back is actually in a bent position relative to your upper body. Think about it. Whether you bend your upper body relative to your lower body or your lower body relative to your upper body, the movement in the spine is the same. Now, borrowing from the message of my previous video, think what 4 or 5 hours of sitting will do to your spine. To counteract the effects of all the forward bending that you've been doing while sitting, you want to give movement to the spine in the opposite direction, which is bending backwards. And this brings us to our first exercise. This first exercise is called a sloppy push-up. And if you have an extension or a bending backwards preference, or if you sit for long periods of time throughout the day, you may find this exercise helpful. All of you people watching this video who have sciatica, you may find this exercise helpful as well. This exercise needs to be done on the floor or a carpet or a yoga mat. You can't do it on a couch or a bed because those surfaces are too soft. Start on your tummy on the floor with your palms face down at about the level of the top of your head, and push your body up with your arms until your elbows are locked completely straight. Keep in mind that the more flexible your spine is, the closer to your body you can place your hands, and the more stiff your spine is, the higher you will have to place your hands. Make sure your arms are doing all the work and not your back muscles. Lift yourself up only to the point where your pelvic bones are still in contact with the floor. If they lift off the floor, you've gone too far. At the end position, the tendency is to clench the buttock muscles, so take a minute to breathe out and relax them, and feel the effect of this position on your lower back. An alternative to this exercise is in the standing position. This is great for people who have returned to work in an office or if you just can't get down to the floor. Turn your back towards a wall and with your feet about 1 to 2 feet away from the wall. Remember, the taller you are, the further away you will stand. Lean your upper back against the wall and push your hips forward until you feel your lower back arching forward. It should feel similar to what you felt while doing a sloppy push-up. Exercise prescription for this exercise is as follows. You can start this exercise with no holds, progressing to 10-second holds. Start with 10 repetitions, which consists of 1 set. progressing to 3 sets. And you want to be doing this exercise throughout the day, especially when your pain levels are higher. So about maybe every couple hours. As your pain relieves, you can decrease the frequency of this exercise. Important thing to remember here is to not hold your breath while you're doing any of the exercises. If you find relief with this exercise, your directional preference is into extension or bending backwards. Use this technique for pain relief if your directional preference is into extension. Do this as many times throughout the day as you need to. We now move on to the pain relieving technique for people who have a flexion-based or a forward-bending directional preference. This is not so much a movement as it is a position. This position is called Z-lying. Z-lying can be done on the floor, yoga mat, or carpet. Again, a mattress or a couch will be too soft. Start by lying on the floor with your knees bent over a chair. Add a folded pillow under your buttocks so that your pelvis falls backwards onto the floor, flattening the arch in your lower back. Adjust your position so that your knees move past the level of your hips, and it's this alignment of your hips and knees that gives this position its name. In cases where the pain is more severe, you may not tolerate a Z position and may prefer a 90-degree position instead. Here, your knees and your hips will both be bent at about 90 degrees. You may not get relief immediately, and it may take a few minutes for this position to start having effect. You can relax in this position for 10 to 15 minutes. Many people also find that putting a heating pad under their back while lying in this position gives their muscles significant relief. If you aren't sure which direction your body will prefer, try both positions. Let me know in the comments below which position your body found most comfortable. And this brings us to the end of today's video on pain management for lower back pain. I'll be making a separate video on exercises that you can do to help treat lower back pain, so keep an eye out for that video. As always, if you enjoyed watching today's video or learned something new, please give us a thumbs up. Please share this video with family and friends, especially those that do have lower back pain. Subscribe to the channel and hit the bell icon to make sure you don't miss any future videos. If you have any questions, please put them in the comments below. If you have any conditions that you'd like to discuss, you can email us again at the email in the information provided below. Let me know if these exercises helped relieve your back pain. I would love to hear from you all. Until next time, this is Surabhi saying, Auf Wiedersehen.